Discuss what we can expect from the President this evening with health expert Dr. Kgosi Letlape. Dr. Letlape, thank you so much for your time. So the peak, I was saying earlier on, at the peak of the third wave, which, by the way, the wave by many accounts and by your expertise in the industry has not gone away, but we've reached the peak. At the peak, 22,910 cases in a 24-hour cycle on the 8th of July. Yesterday, we were at about 12,000, and 12,000 seems to have been the average for the last week. Over 6 million vaccinations that have taken place. Does this allow for, a tweak of the regulations, and if so, which of these regulations can be tweaked?
I would hope that the status quo remains for now. Remember that in the last 2 weeks, we've also had the unrest in the country. So we may see numbers coming through in the next week or two from those gatherings. So I wouldn't be too quick to take the foot off the pedal. I would keep things as they are for another 2 weeks and then hope that our numbers by the next 2 weeks will be way below 5,000. Then it would be time to take the pedal off and ease some restrictions.
And Dr. Letlape, from what you are saying, you are urging caution in this particular situation, worried that perhaps what we have now is not the full picture of the impact of the last 2 weeks.
Yeah, remember, if we didn't have the last 2 weeks, we'd all be happy that we're trending down and we could start easy. But we know that when you have events that can give you a surge, it'll take you 2 to 3 weeks to see those numbers come through the system. So I would wait that it plays itself out before I make any changes.
What are the risks of not taking that cautious approach?
Well, the risk is simply that you then have an upswing again and we start racing towards 20 again. So for me, we should not be in a hurry. If you look at it globally, anywhere where people have hurried back to reopen, they start having problems. You look at the US, the states are red. The numbers are increasing in almost every state. The mantra is now to say, oh, this is because of the unvaccinated people. Now, these are countries where you have vaccination rates of about 70%, where over 60s they have 70% who have completed the 2 doses. We are sitting at just over 6 million. That's 10% of our population. And I would ensure that more effort is put on ensuring that we access more vaccines and we put them into arms as quickly as possible. I would be doing a secondary work to say they're above 60s. What percentage of them are vaccinated? What percentage are not? Because they are the ones that suffer the greatest morbidity. And I would come up with other alternatives to ensure that the over 60s out there that have not been vaccinated come forward. And I would be looking at adding the strategy of not waiting for the people to come to our vaccine centers, but to take vaccinations to the people. Utilize all other avenues, nurse practitioners in the community, GPs in the community clinics that are out there, so that we get as many people vaccinated as possible.
Yeah.
That should be the emphasis. And you do not need to take the foot off the pedal once you accelerate that.
Sobering inputs there, Dr. Letlape. Just take us back then to give us, I guess, a reality check of the health system risks, right? In terms of what we're looking at in terms of hospital admissions and the pressure on the healthcare system, what you've been seeing on the front lines as we head up to this briefing by President Ramaphosa this evening. Has that eased somewhat as we see these numbers coming down? But as you say, has it eased enough from a health, the ability to cope system perspective?
It has not eased enough. The frontline primary healthcare workers are still hard at it. The ICUs are still busy. The COVID wards are still busy. So we do not want to increase pressure on them. And I think now that you raise the issue of systems, I hope maybe the president would begin to heal this broken society. Part of the issue that we are contending with because of COVID, because of the unrest, is inequality. And I would like to hear the state president begin to put in place measures to take out the inequities in health and the inequities in access to basic foods and the abject poverty that we find ourselves in.
Lastly, Doc, and I'm pressed for time, but so as a wrap-up then between you and I, when you hear people, focusing on the issue of alcohol and saying, oh, Abovulwe, he must open up, we're tired now. When you hear people talking about, let's go back to church, let's operate at 100% in as far as church is concerned. Or open up the borders. We want to leave Gauteng and go on holiday at Sudwala Caves, etc. I don't know, wherever people go for holidays. What goes through your mind as a health expert?
What goes through my mind is that people don't seem to understand that this spreads through gatherings. And we cannot take the pedal off and allow people together, because we'd then be falling into the hands of the virus. And I hope the president keeps all the measures in place. I always get surprised where it looks like God lives in buildings called churches. Why do people need to get into a building to worship? Most religions say you can worship where you are. So people can still keep their faith, but still uphold the regulations that we have of socially distancing.
All right.
Masks all the time and washing our hands. Those are not mutually exclusive. On the issue of alcohol, I'm not a fan for bans, but evidence has shown the impact that alcohol has on our healthcare system. Until the situation in the hospitals and in the healthcare systems eases, we need to stay with all the measures that we currently have.
Dr. Kgosi Letlape, I'm glad I spoke to you. It's a nice balance between the views that I've been getting for a majority of this afternoon. Just to hear from you, from your own perspective, urging the president there to keep the status quo and not take the foot off the pedal just because we are seeing the numbers starting to trend downwards. Thank you so much for that, health expert there, Dr. Kgosi Letlape. I know, this is not, his message is not for everyone, right? It's not what all of you out there who've been ready in your throats want to hear. This is Upfront on eNCA.